My name is Edo Kaluski. I'm the director of the Cath Lab in Interventional Cardiology in Robert Packer Hospital and Guthrie Health Systems. My topic was transulnar interventions. The Americans have discovered the radial artery 10 years after Europe and are currently engaged in a wide educational efforts to train everybody in the transradial approach. Kind of a forgotten artery is the ulnar artery that sits 2 inches away from the radial artery, similar size. That seems like nobody is getting trained in doing interventions through that particular artery. So the purpose of my presentation is to show how transulnar interventions can be done in a safe and effective way to perform either PCI or other vascular interventions. Essentially, the ulnar artery is quite similar in diameter to the radial artery. The technique is somewhat different in the puncture methodology, but otherwise than that, any interventional cardiologist engaging in radial interventions probably could be easily trained with transulnar interventions. And essentially, I believe that in the future, they will have quite a similar role. The ulnar artery is somewhat more hard to palpate, a little bit deeper, so it demands a little bit more skills, and maybe ultrasound guidance may be of help, but you use the same adjunctive pharmacotherapy and the same tools that you'd use for transcranial intervention. Since around 5% of the patients have radial artery occlusion after transradial intervention, and since around 5 to 10% of the patients transradial intervention cannot be done, I believe that before we go femoral, we should seriously consider transulnar intervention.
Okay. Now, were you here for the opening lecture with Dr. Bromwald? Okay. So, I mean, how was your feelings on being able to see basically who's one of the founders, I guess, of modern cardiology do a lecture?
Well, Dr. Bromwald is always an inspiration. He has taken cardiology to new and exciting frontiers. He made modern cardiology what it is. I think him and his many students have brought cardiology to where it is today. So it is absolutely exciting to see this man continue with the same excitement, delivering a very interesting and concise and accurate view of where cardiology is heading at 2016.